So
Bartering. Bring back
for me,
bartering.
that employee process was always a little challenging. I know for a lot of chiropractors it is. What is your most challenging aspect of being in practice?
I think my most challenging aspect is to get other people to understand the vision. But I
Mhm.
think once they're on board with it, then they're like, "Oh, that makes perfect sense. Why is everyone not doing that?" I'm like, "I don't know." But yeah. Oh, also, I would say too, in regards to staff, all the full-time staff that I have right now are actually either former interns or former patients.
They make the best ones.
Yeah, yeah, my interns, like, are stellar. So, it's really exciting to be able to, like, pull from this excellent group of students that are, excited about what we're doing already, and they got trained for free because they were my intern already.
Great. Now, what's the most rewarding part of being in practice?
Honestly, I think it's really just, like, patience and, like, seeing people get better, which is, like, kind of lame and, like, a cliche answer, I guess, but it's really remarkable when you have someone walk in, like, with a cane or a walker and then leave without it. It's just stuff like that, or even if it's, like, you see patients, like, in public later, and they're like, "Oh my gosh, like, you really have changed things for me." I'll remember I think it was my first year in practice, I had a young mother who she came to me through pregnancy Medicaid, and I was the only provider that, like, takes Medicaid that she was able to see during her pregnancy in my area. And I ran into her a few weeks later, like, in a shopping store. I think I was in, like, Kohl's or something. I ran into her later, and she was like, "Dr. Bree," and I was like, "Hey." And I ran into her, and she was with her mom, and literally her mom in the middle of the store, we were in the shoe section, I remember this. Her mom, like, broke down into tears and was like, "Thank you so much for taking care of my daughter because you're the only person that could help her in that time, and I'm just so grateful that you were there and were willing to, like, take her case when everybody else wouldn't." So, and it was really crazy, like, having this insanely emotional moment in the middle of a store with a woman I have never met just because I helped her daughter with something months prior. So, I don't know, I think it's stuff like that. That's the reason why I do it. I'm not doing it to be like a quadrillionaire. I'm not doing any of that. Like, clearly, from based off this interview alone, I give away a lot of care. So I'm not doing it to be rich. I'm doing it to really provide richness in my community.
That's outstanding, and what a great answer. And it's a shame that a lot of us think of that as cliche, but really that is why most of us got into it in the first place. I mean, the people who get into it just to make, I mean, you have to make a living, of course. The oil guy's not going to do it for free, but you have to make sure that there's purpose and integrity in it. And it's just a great part of the job, man. It really is a wonderful part of it.
It is amazing, and then
Yeah.
especially, let's say, you see that mom while the baby is still growing, and then you see the kid, and then they grow up. Actually, my very first the very first Essence baby ever actually just turned 2 years old. So,
Awesome. Wow.
yeah, and actually crazy enough, speaking of tattoos, her mom actually tattooed hold on, where's it at? Right here, it says Essence. She tattooed that on me.
She did that?
The mom did, yeah.
Oh, wow, that's so cool.
Yeah, and I met her at another through another community event. Her
Yeah,
midwife I met her at a health expo, and then the midwife referred her to me.
wow. I hope I
Yeah.
never get tired of that, and
Yeah, that's the best part.
it's so awesome, and it happens so often where people say, "I couldn't walk and now I can, and to change my," I always put it back to not being me, but what I do and how
Mhm.
privileged I am to do it, and I actually will thank them. And I think
Yeah.
and I learned that from somebody else. Somebody else told me, "No, I thank my patients for allowing me to do that." And I said, "That's a great idea." And I started doing that, and it's the truth. They allow us to do something that's a
Mhm.
wonderful, wonderful thing. And it's such a common answer with all of us. We do think it's cliche.
Yeah. Well, that's the other thing too. One of my other mentors, Dr. Daniel Rowe, he was the first person to ever adjust me actually in Oklahoma City. He's the father of my best friend from high school.
Mhm.
But anyway, he always says, like, every time you leave his office, he'll be like, "You know what, Vinny? Like, it was great to see you today. Like, it was an honor to serve you today." He says that to almost every patient when they leave. And I'm like, "You know what? An honor to serve you." I really like that. And people feel really, like, special about that,
Yeah.
because it really is like being a chiropractor is service. So that's my little thing I do every day.
Yeah. What a great thing.